Hi everyone, welcome to the last session of the World Bank and IRAC Helping Save Lives in Africa, BIGRS 2020-25 webinar series. Today we'll present case studies in Africa and establishing IRAC. My name is Alessandra François and I'm the Training and Accreditation Coordinator at IRAC, and I will be your moderator again today. Again, as well, our housekeeping. We'll have our webinar has 90 minutes. All attendees are muted, but you are welcome to post your questions on our chat at any time during this presentation. And the presenters will stop after their presentations and I will read the questions for them. Just to let you know that for sessions 1 and 2, I have posted the answers to the questions we didn't have time to answer during the session. So I posted a file with the answers for you on the respective folders. So part 1 and part 2 are there. And this session is being recorded. The video and the presentation files will be available to you tomorrow on Schoology. Today is our last session. We'll talk about case studies and establishing a rep. We have 3 presenters. You've seen Julio Urzua, the Strategic Projects Director at IRAC. Hi, Julio, how are you?
Hello, good morning or good afternoon, Alessandra.
Thank you. And Luke Rogers, the Global Operations Manager at IRAC. Hi, Luke, welcome to our webinar series.
Hi, Ali. Yeah, nice to be here. Thank you for inviting me. And yes, I'm very looking forward to this session.
Thank you. And Rachel Nyanwa, the consultant for Global Road Safety Facility, the World Bank. Hi, how are you, Rachel?
Hi, Ali. Hi, everyone. Thanks for joining us on our last day.
Thank you. And our presenters will present, Julio will present how to develop a locally owned and led RAP in your country. Luke will present how to plan and procure an IRAP assessment with accredited suppliers. Rachel will present case studies in Ethiopia, Ghana, and Ivory Coast, Senegal. And I will conclude the session presenting the training and accreditation program at IRAP. And we'll also give you the instructions for the last assignment. So to start our webinar session today, I will hand over to Julio, who will present how to develop a locally owned and led RAP in your country. Julio, the screen and the mic are yours.
Thank you very much, Alessandra, and welcome everybody to this last session. In this presentation, I am going to talk about how to develop a locally owned and led RAP in your country. So the idea is to know how everybody can create a local program in any of the countries where you live. So next one. To start this presentation, I wanted to present to all of you what is the RAP history and why now we are in a position of proposing you to create a locally owned RAP program. So the RAP history is now quite long. All started in 1999 in Europe with the creation of the Euro RAP program. Then this program developed until in 2005. Already 20 countries worldwide were using this methodology, and it was created by that time programs in Australia, in New Zealand, and in the United States called AusRAP, Kiwi RAP, and US RAP. Then in 2006, new RAP techniques for low and middle income countries were created, and in 2008, the China Ministry of Transport signed a partnership with IRAP and created China RAP. Then in 2010, as you may recall, the Decade of Action, the first Decade of Action was launched. And to 2012, already 70 countries worldwide were using this technology of IRAP. Then in 2013, the South Africa RAP program was launched, and in 2015, the Sustainable Development Goals also were launched. Then we get to 2017, where IRAP launched the Vaccines for Roads website engine that I encourage you to visit it, vaccinesforroads.org. And then in 2018, a program in Thailand was launched, and just recently, a couple of years ago, programs in Malaysia, MyRAP, and Brazil RAP were also launched. Therefore, there is a chance, as you have seen, to create a local program. And in this presentation, we are going to see and review how you could be able to encourage your country and authorities to create your program in your country. Next one. So, as you have seen, IRAP is a program that is based on the collaboration and partnerships around the world. And we have created different partnerships, and there you can see some pictures of people that are collaborating and working on IRAP programs in different regions. But in order to do this, we have to follow some steps that we are going to review now in this presentation. Next one. So why is it important to create a local program? Because we have to jump from projects that we are developing in different countries to national and national programs which have a global impact and a national impact. Let's take a look at the global picture. I think that on this training, on the 4 sessions that you have attended, you have seen that there are targets on road safety that have been encouraged by the United Nations. Specifically, on the global picture, Target 3 and Target 4 are very clear to establish that the star ratings methodology should be something that should be attained by 2030, so in 10 more years in this new decade. And it says specifically that all new roads, they have to achieve technical standards for all road users that take into account road safety or meet a 3-star rating or better. So there's a clear statement. And in the case of Target 4 is very similar. By 2030, more than 70% of the travel should be done on roads that attain 3 stars. What about if we, as a world, we attain these 2 targets? If we meet the targets 3 and target 4 in 10 more years, 467,000 lives will be saved in a year. So the impact is very, very big. 100 million deaths and serious injuries will be saved over the next 20 years. And the savings are going to be on a benefit cost ratio of 1 to 8. So for $1 invested, $8 are going to be saved by saving lives. And in the national picture, I just put an example there of one country, Zambia, but you can do your own research in the link that is underneath the table, vaccinesforroads.org. If you go to business case, you are going to be able to see what's going to be the specific impact in your country. So we created a map, and in this map you can click on your country and you are going to see an analysis such as the analysis for Zambia that is written there. Next one. So why creating a local program is important? Why the program has to be led locally? Simply because we would like local leadership with local people managing the program with a local impact, an impact in the country, with building local experts. So what we are doing in this seminar webinar is exactly that, creating capacity and local results. All of this is going to be supported by a global family that is called IRAP, with different partners around the world for the mutual benefit of all people. And as I said at the beginning of the presentation, that includes MyRAP, EuroRAP, BrazilRAP, etc. So now, next one, we are going to review the steps that we propose to do this. So the first step, step number one, how can you establish a RAP program in your country? The first question that you have to ask to yourself, is there an existing national or regional road safety program in your country? If the answer is yes, you simply contact the program lead and integrate your ideas with the people, the local people. If the answer is no, you can contact always IRAP, and we are going to try to help you and to support you to create or to start establishing a RAP program in your own country. So we have the list of people that are leading the country programs in different countries. In the case of, for example, the case of China, Dr. Tiejun Zhang is the leader. Or if you in Brazil, the country where I live, Engineer Luis Guilherme is the leader. So you can contact these people, and if this program doesn't exist, you can always contact IRAP to start this idea. Next one. So after you answer this question, the step number two should be a local scan. So complete a questionnaire that is going to be available as part of this webinar. The link is there underneath as well. It says questionnaire, and this is a small link, but we are going to provide you the link. So you complete this questionnaire looking at existing local agencies, data, systems, activities, and you can answer this type of questions such as existing road safety strategy, existing crash data. Is there crash data good quality in your country? What are the roles of a lead agency in road safety? Is there a lead agency? What is the priority road network? Are there roads that are more important because of the number of vehicles that travel on this road than others? Are there mapping video? What is the condition data, etc.? Important to complete this questionnaire to have a local scan of your country. Next one, step three. Step three will be identifying those people that are important for road safety in your own country, identifying what we call local champions and lead agencies. So identify how a national or state-based program can be established with local stakeholders, and start nominating some roles. And there you can divide the type of leadership into government, so maybe Ministry of Transport. In some countries, the Ministry of Transport and Public Works are together in one minister. Road agencies, Treasury, because they need the funding, police, health departments, etc. But there are also NGOs, so, for example, the mobility clubs from the FIA, or road safety non-profit institutions. In Africa, there are many institutions that are not for profit that are working on road safety, engineering associations, industry associations, etc. And also it's really important to have also the support from universities and research agencies and institutions that are more academic in order to get support from these institutions. Next one. So this is a step three in identifying the local champions. Step four, getting to know the family, what we call. So you are always invited to participate in the next upcoming IRAP event, or talk to an existing program lead from another country. We are all the time, as now, organizing seminars and organizing events to try to get everybody in the IRAP family updated into the last news. Next one. So step number 5, once you have identified all the locals and scan your country, it is important to start knowing the protocols. And as you have seen in this webinar series, basically the protocols of IRAP are the risk mapping, the star ratings that you are already familiar with, and also the investment plans. So there are training courses. My colleague Alessandra Franzoia is going to also present the training and protocols and the accreditation possibilities that we have, but it's important to have this. So the step number 6 is going to be this: undertaking IRAP training and accreditation. Which training? It's depending on your own necessities. We have an introduction to IRAP, establishing an IRAP program, introduction to IRAP methodology. We also have training on survey, on the coding process, on planning and procuring a RAP project. You can also take a training on VIDA analyst in order to go to the software and process data. There are also tools for designs where the roads are not existing. They are just on the projects, which is called Star Rating for Designs. We also have a program on schools in which we can analyze the school area, especially for kids that are pedestrians, right? Go and back from school, crash rate risk mapping, Star Rating Essentials, VIDA Creator, which is the highest level for VIDA, etc. Go to irap.org training and accreditation and pay attention to the presentation, the next presentation from my colleague Alessandra. Step 7, and we are almost finishing. You also need to agree on a structure. This is always a question that is asked. What is the best structure to create a local program in my country? And the answer is, it depends on the necessities of each country. For example, in the case of EuroRAP, there's a general secretary and there are members. But in other countries, there's one coordinator and there are different groups that work together. It's important, and we recommend, but again, it's not something that is required. We recommend that every program has a program lead, a road upgrade management lead, because we need to upgrade the road to save lives, and also technical governance lead, and a communications leader, because we also, you will see that one of the last steps is to celebrate success. Next one. So before going to the next, the two last steps, 8 and 9, I wanted to show you like a little and very quick, in a couple of minutes, case study. Ale, if you can click several times to complete yeah, like this. So this is Australia, in the state of Queensland in Australia. The program leadership there is led by IRAC, as I mentioned before. And IRAC, they did assessments on a road that is called Bruce Highway, in which they did an assessment on the new road, and the conditions of the road increased dramatically from 2 stars to 5 stars. So there was a policy leadership after this that created this policy of Queensland target, 90% of travel on 3-star or better roads by 2022. There was also capacity building, so training to the people to know how to use the technology, and also a big investment of more than $1 billion Australian dollars invested on safety. And in terms of implementation, there was a timeline in order to plan an implementation steps to get to this point of creating this new infrastructure. And very important, communications and advocacy. All of this was communicated to the people. So the authorities, they can communicate when an infrastructure goes from this level of infrastructure to a better level. So they increase and improve the star ratings. And finally, what we call measurement of success. So the safety jumped from 2 stars to 4 stars and 5. So 20% of them were 5 stars. And most importantly, and this is maybe something that we never have to forget, 82% of reduction in fatal and serious injuries. This is what they got. So this is just a small example of how you can create your own program. In this case, in the state of Queensland, in Australia, but this can be replicated in your countries. So let's go to the last 2 steps. Next one, please. So step number 8. It's important to celebrate, to share the success. We jump from 2 stars to 4 stars. We jump from 1 star to 3 stars. The conditions were this before, and now they are much better. So step 4, important to coordinate with the communications leader and to share the success with the local people in the country and also with the global partners. The last step that we also encourage people to do is to formalize these partnerships. So institutions, many times they work with people and people are changing, right? Sometimes you have one leader in one agency and then after 2 years, this person is not there anymore. So it's important to formalize this partnership, to have an umbrella, to engage with IRAC or the regional national program lead to, for example, signing a memorandum of understanding or another document that formalizes this national program. So as a summary, these are the 9 steps that every person that is interested in creating a local program should take. So to get started, visit IRAC.org, Partnership to Save Lives, sign up our newsletters and go forth and take action. From the people that are attending this presentation have to ask this question: am I a state or local government? Am I a member of a federal government? Am I a supplier, a company, or a mobility club, a funding body, etc.? And then you have all these steps that you should take in order to collaborate to create a local program in your country. Thank you very much.
Thank you, Julio. A lot of interest in developing a rep in a country or region, and we have a few questions for you here. First question is if they can implement or initiate a rep in a state or region instead of a country, or it's only on a country level.
Yeah, good question. No, it's as I showed in the example of Queensland, this is just a state in Australia. Therefore, you can implement a local program in a state or a region or in the whole country. If the person is working in a state, I would recommend that it's implemented in this particular state.
And thank you. And another question asking if a private company can establish an IRAC program.
Yeah, it's a question that it has been asked before. I think it is absolutely possible. However, the stakeholders, they have to include, as I showed in my presentation, the government, NGOs, and also the academia and the private sector. So an IRAC program doesn't belong to any person. It's a collective effort composed by the government, as I said, the not-for-profit institutions, the companies, and also all the stakeholders. So as long as this private company is coordinating with everybody in the region or in the country, it's fine.
Okay, thank you. One more question. How much does it cost to develop a locally owned program in a country?
No, it doesn't have a cost. The cost is just the cost of the coordination of all the efforts and the effort to take in the training courses and to follow the steps. So doing a local scan, contacting the champions, taking the training courses and coordinating everybody. There's no cost to create this.
Okay, thank you. And also, Julio, they are asking about the specific countries, if there is a RAP, and if who is the organization that is leading. Do we have everything informed on our website?
Yeah,
Here on this slide.
Yeah, the country RAPs are in our website. So the first thing is to see if there is a country or a RAP or a state RAP in the country. If not, people should contact us, and we are going to support to create a local program in the countries.
Thank you very much, Julio. Good presentation and very informative. Lots of interest here. I think we'll receive a few applications. Thank you very much. We received other questions about the next topics. I think we can hold to answer during the presentation. Thank you very much.
My pleasure.
We will now move to the next presenter. Luke Rogers will present how to plan and procure an IRAP assessment with accredited suppliers. Luke, please, welcome to our webinar series again, and the screen and the mic are yours.
Excellent. Thank you very much, Alessandra. Yes, as I said before, yeah, it's great to be here to speak to you all today. My name's Luke Rogers, and I'm the Global Operations Manager at IRAP. So what does that mean? I manage the team of road safety engineers that we have at IRAP, who work on a lot of the strategic projects that we have around the world with various partners. It might be donors like the World Bank, or it might be national road agencies or other organisations to develop projects. So where Julio was talking about developing programs, what I will speak to is about setting up individual projects. So that's assessments of roads and how you would go about planning and procuring those individual projects, either by yourselves or more commonly using accredited suppliers. So star rating assessments can be undertaken by anybody. That's the first thing to say. Really, that we would advise them to be undertaken by any trained road safety professional or supplier. National, regional and local government staff, development bank staff, NGOs, consulting engineers, automobile associations, research agencies, students and supplier networks all perform IRAP assessments in some form or another in Africa and in other regions. IRAP provides a range of free software and training materials, methodology documents, research and technical papers, various presentations and specification documents to support assessments all over the world. And although accreditation is not mandatory, we do encourage road authorities and others to use suppliers with IRAP accredited systems and who have staff accredited to perform IRAP activities. So as I say, in theory, anyone can deliver the project, but it does require knowledge and understanding of the methodology and the software and the skills that are developed through our accreditation process and experience to deliver good quality outcomes. We have several training courses available that Julio touched on and Ali will speak about later. And also individuals can apply for accreditation to perform the survey part of a project, the road attribute coding, so that's recording the road attributes at 100-meter intervals, and also in using the VIDA software for the analysis and reporting. IRAP also accredits road survey systems and coding software, and a list of all accredited systems and individuals is available at irap.org/accredited suppliers. So very much like when we're setting up a road assessment program, there's a similar sort of starting place that we have to think about when we're planning and developing an individual project. So it's quite a similar process in the early stages. So when planning and developing a project, it is important to identify those project stakeholders. That is, who are the people who can help make the project a success, and who will make use of the results to make our roads safer. So it's one thing to assess the roads and get a star rating, but really we want those results to be used to make the roads safer. So we do encourage anybody who is going to do an IRAC project. We think it's good practice to organise a project planning workshop that should really include project partners from various different areas. So that might include from the road agency and other government organisations and departments. It can also include suppliers and researchers, members of the local road assessment programme, if there is one, and the local community. Those that might pay for either the assessment or the upgrades of the road. So those might be development banks and other donors, plus NGOs and the local media, who can often help to communicate the project objectives and outcomes to a wider audience. So which roads should we assess? Selecting the network to be assessed is a key decision in any project that we do. Often the roads that need to be assessed will be obvious, but not always. Crash data can often help us to identify roads that need assessment. So if there is good crash data, that might point us in the right direction to the high risk roads that we should assess. But where crash data is limited or is in poor condition, you may decide to assess the highest volume roads. Some national data suggests that around 50% of deaths occur on around 10% of the network. So assessing the top 10% in terms of traffic volume is a common approach. Many projects focus on the major classified road network, like state or national highways. Others may concentrate on local roads in an urban transport project, for example. But whatever the roads that you select in your project, it's important to focus on the roads that have been identified for upgrade, and that you can work closely with the road agency responsible so that improvements can be made. At the start of any project, it's important to set clear objectives, and this goes for any project, not just road safety projects and IRAC projects. In some projects, the client wants to know how safe the roads are. In others, we may want to know how the safety of those roads could be improved. Some projects assess the safety of proposed road designs and look at identifying cost-effective improvements in the design. Others may want to identify the potential locations for future fatal and serious injury crashes. Other objectives could be to see if safety on the roads is changing over time, to achieve certain star rating targets, like Julio mentioned in the previous presentation, or to build local capacity to perform IRAP assessments. The various IRAP protocols that we've spoken about in the different sessions can certainly help you to deliver all of those different outcomes for each one of those different projects. For example, the safety of roads can be measured using the IRAC star ratings or through crash risk mapping. The safer road investment plans will help to identify cost-effective treatments and can improve existing roads and proposed designs. Performance tracking, that is the repeated assessment of a road network using either the star rating method or using crash data through crash risk mapping protocol to track safety performance over time. So there's lots of different protocols that can help you with your different types of projects. It's important to be aware of the different key stages in most IRAC star rating and investment plan projects. So once the objectives and the health and safety plan and the scope of work and the road network has been defined and the suppliers have been selected in the project planning phase, then the survey can begin. That's the sort of main sort of data collection part of a project. The road attribute coding phase follows that, along with the supporting data such as traffic speeds and traffic volumes, which is typically collected during or in parallel with the road survey. That data is then combined into an upload file and processed within the IRAC VIDA software with data analysis and reporting as the final stage. Each one of those stages can be delivered by either one supplier or separate suppliers or my IRAC team, but all of those stages will be subject to external quality assurance reviews to make sure that the results and the data are of good quality. And they'll often include a training element or a briefing so that clients and other project partners can understand the methodology that's being used to create the results and also to use those results to maximize the safety outcomes of the project. You will want to decide what outputs or deliverables are needed, in particular what reports and what data, training and analysis are important to your project. And there are many standard outputs provided by the VIDA software, so different charts and maps, and those are described in the IRAC manuals, but they can and should be tailored to suit the requirements and the objectives of your particular project. So for example, in your project, you may wish to identify the location of every poor quality pedestrian crossing that has been identified on the assessed road network, or perhaps you want to know what happens if to the star ratings on your roads if we change the speed limits. You can even use the VIDA software to develop an investment plan to match a certain budget type or amount. So if you've only got a certain amount of money to spend on upgrading your roads, you can use the software to find the optimum upgrades that will fit any particular budget. One question that we are often asked is how much does an IRAC project cost? So we got asked that question, or Julio got asked that question in the previous slide about how much does it cost to set up a program, and that really doesn't have any sort of outside costs other than the setting up of various groups when we go through those different steps. But an IRAC project certainly does have costs involved. And to answer the question on how much does it cost, it's actually a very difficult question to answer, partly because no two IRAC projects are ever the same, but it's but it's also that different suppliers may be used for different stages of the project. So these types of things can change in different projects. So while there is no fee for those using the IRAC methodology to assess road user risk, so you could do it for free if you had the right knowledge and had the right training, nor is there a fee to use the IRAC VIDA software to view or to process the data and to generate the star rating results and the investment plans. You may need to pay for the data to be collected, such as the road survey, the road attribute coding, the supporting data like traffic volumes and traffic speeds, unless you're performing those activities yourself. So costs will vary depending on a range of factors, including the length and the location of the network to be assessed, the size of the team that's collecting the data and processing the data, any time constraints or deadlines, obviously the quality of the data, the equipment and the systems used to collect that data. So some surveys will use a reasonably low cost GoPro or Garmin camera to collect the data, but often the coding that has to happen at the next stage. If there is no coding software, when we use that type of low-cost survey data, we might see additional costs in the coding part of the project. So all of these different things can affect the price of a project. Often we'll see the price per kilometre decrease as the assessment length increases. So that's certainly something that we often see. The larger projects that might survey 3,000 kilometres, you'll get often a decrease in the rate per kilometre for those larger projects. The other thing that people will often ask me and my team in IRAP is how long will it take to do an IRAP project, and that really depends on how long the assessment the network is. So to give you an idea of the time it takes to do an IRAP project, we can break it down into those different core activities or key activities in an IRAP project. So the road survey data, which includes the video images and the GPS data, but also would include usually speed and traffic flow sample data collection, can be collected at approximately 200 kilometers per day, say on an expressway type road or a motorway. Perhaps that will drop to 100 or 200 kilometers per day on a rural road, and perhaps 50 kilometers or so per day on city roads, with between 1 and 5 days for quality assurance reviews. For road attribute coding, an experienced coder using a good system can typically code up to about 20 to 25 kilometers per day on a standard expressway type road where the cross section remains fairly consistent. That rate will tend to decrease or reduce with more complex roads in cities and towns, for example. The external quality assurance of at least 10% of the coding is required. And then to generate the star ratings and investment plans, including putting together the input file, setting up a data set within VIDA, the VIDA software, processing the data, analyzing it, and producing a standard kind of report can take somewhere between sort of 10, 15 or 20 working days, with 3 to 5 days of quality review work. And finally, I just want to show you the IRAP project planning manual that's available in the specifications section of the IRAP.org website. It covers everything that I have spoken about during this webinar session, including who can do an IRAP assessment, engaging stakeholders, developing a project plan, and procuring services and equipment. The project planning manual also includes an IRAC standard terms of reference that can assist those who want to undertake or procure IRAC specification activities. It can be copied and amended to suit your project when engaging consultants and suppliers to deliver services relating to IRAC assessments. The scope of work describes all of the IRAC assessment related activities that we've spoken about, and the list can be adapted to fit your specific project needs. So you can cut and paste from those that list of deliverables as you see fit, and then you can advertise that terms of reference if you want to get accredited suppliers to bid for work to help you on your projects. So that is a sort of quick run through on how you can plan and procure your individual IRAC projects. Yeah, just to say thank you for listening, and I'm happy to answer any questions that anybody may have.
Thank you very much for your presentation, Luke. We have a few questions that varies about the process and the project. One question is asking if a firm can approach IRAC to fund a pilot project. And actually, we have another similar question asking who can fund an assessment in a country, who usually pays for it?
Okay, yeah, good question. Yeah, we don't often fund many individual IRAC projects. We will support those that want to do projects, but we don't tend to fund individual assessments on roads. In terms of who would usually pay for an IRAC project, that really varies from country to country and project to project. I mean, often the road authority will pay for an IRAC project because they own the road. They're responsible for the safety of that road and the design of that road and the maintenance of that road. So often it's the road authorities that will use the IRAC methodology, and many road authorities have adopted the IRAC methodology to assess the safety of their roads. So they pay for the surveys to happen. They don't pay us to do it necessarily. They will go out to supplier networks, just like they collect. Road authorities will collect lots and lots of different data on their roads, and the safety data is only one part of the data they collect. But they would often pay for that data to be collected and then for it to be processed through the VIDA software. Development banks are another form of donor for projects. They will often pay for projects through road authorities. So often the governments can get funding from people like the World Bank, the African Development Bank, to get surveys and upgrades done, and also aid agencies from around the world as well often will fund assessments. So people like Bloomberg Philanthropies, places like the Global Road Safety Facility, and the World Bank can also fund assessments.
Thank you, Luke. There is another person asking if there is a cost for this quality assurance process. Actually, he is even detailing, verifies the star rating process and then the star rating achieved, if there is a cost for this.
Yeah, there doesn't have to be a cost to doing an IRAC assessment. You can do an IRAC assessment and get a result from the software. But yes, if you are looking to get your results quality assured, and you want IRAC team to do that. Yes, there is a minimal cost involved in that. The quality assurance, the external quality assurance, doesn't have to go through the IRAC team. It can be contracted out to any accredited supplier. But yeah, there would be a minor cost involved to get the data quality assured. Yes.
Thank you. One more question. How does IRAP deal with the national standard of local countries?
Do you mean the national standards in terms of road designs?
Yes.
Yeah.
Does it clash with our methodology?
No. We do work with lots and lots of road authorities to star rate their road designs and their national standards. So a lot of road authorities have sort of standard cross sections that they apply to their road upgrades and their new roads. And we work with lots of national authorities, Australia, India, and many others to star rate their national design guides and their standards. Often the star rating that is assigned to a standard cross section, we would need to know the speed of the vehicles on that cross section. So we will often have one cross section, so a road, an image of a road, if you like, or a drawing of a road that will have different star ratings at different speeds. So it's not always, you can't just look at a picture of a road or a standard cross section and know the star rating automatically. You would have to know the speed of the vehicles on that road, but it often doesn't. It doesn't really. I think the question was, does it clash with road authority design standards? No, we find that most design standards are at least three stars. Designs for motorways and expressways often exceed that. They're at 3, 4, and 5 stars for vehicle occupants. So no, we find a pretty reasonably good correlation between the safety of our star ratings and the safety of national guidelines and standards. The problem is, I think, a lot of the time is when the roads are being used perhaps in the wrong way in terms of road users, speeding on roads. That star rating will come down if the enforcement of speeds is not done sufficiently well.
Thank you very much. With this last part of your answer, you also completed another question. Thank you very much, Luke. Okay. Nice to have you on our webinar series. Pleasure. And now we'll have Rachel Nyanwa presenting the case studies in Africa. Rachel.
Thank you, Ali. Thank you so much. So my name is Rachel Nganwa, and I am a consultant for the Global Road Safety Facility, and I'm actually helping them mostly on the projects in Africa. And that's my role generally, even with IRAC. So if we can go to the first slide. On Tuesday, the first session of the webinar, we talked about the various projects that are happening or occurring in Africa. And this is just a quick reminder of where we are working. And I'm going to try my best to give you a little brief about, 4 key projects that are, part of these ones. If we go to the next one. So the 4 key projects we're going to talk about in this presentation or in this, for the case studies, are going to focus on the 4 countries that we've worked in. 3 of them would be were funded by the Bloomberg Initiative for Global Road Safety, which is the initiative that's funding this project. And the first one I'm going to talk about I'm going to talk about Ethiopia, which is a project we did in the city, Addis Ababa. We also did some work in Accra City in Ghana. We did a national assessment in Tanzania, and we also did some highways or some big roads in Senegal. So starting off with the Addis Ababa project, We did an assessment in total of 570 kilometers. And a lot of these were at baseline level. So we literally assessed the network that's existing now, and it was only in the city areas under the city mayor's office. So this project was, I don't know if the slides are aligning well with you guys. They're not with me, but the network is actually identified in blue. So that was the entire city network that we assessed in Ethiopia, in Addis Ababa. So since we finished the assessments, this was between 2016 and 2017 and 18. During that time, 302 kilometers have been assessed for designs. And a lot of the work that has been done, we've kind of done scenario tests and we've done testing on what the impact on safety would have been done on some of those roads. So we know, for example, that 90 kilometers of roads, there's been a lot of work done on them, majority pedestrian related, but I will talk about that in a little while. For the assessment of those 570 kilometers, we found that if the recommendations were implemented, there would be over 10,000 fatalities and serious injuries prevented. And we did train nearly 500 people there. From the road development agencies, so from Accra, from TMA, from what used to be called TPMO, it's called, I think it's got a different name now. Also, there were contractors and academia and consultants who were part of the training. And we did get some accredited suppliers from Addis Ababa, from Ethiopia. Next slide, please. So this slide actually talks about some of the attributes that were recorded in Addis Ababa during the assessment. And we find that a lot of the roads in Addis actually have some of the key features that we need. For example, we found that 78% of the roads actually had a roof footpath, a built footpath. What we did find was that footpath was often not accessible. So either the curbs were too high, which generally ended up forcing pedestrians to not climb them every time they kind of go down for a driveway or a junction. They wouldn't go back up, so they would stay on the roadway. That was one of the things that was actually looked at when they were doing the redesign of some of these footpaths and the improvements. We looked at speeds along the networks that we're assessing, and we find that a lot of the vehicles were actually driving within, say, 50 kilometer per hour speeds, but we did find some corridors actually, according to the data we have, 9% were driving at 100 kilometers per hour. And if you remember, this is the city, so it's very urban. It's quite high. So we find that over a quarter of the network actually had speeds greater than 70 kilometers per hour. So hitting a pedestrian at 70 kph will, most likely result in a fatality or a very serious injury, like a disability. Again, in the city, most of the roads had physical medians, which was really good because it allowed, separation of vehicles, but it also allowed for pedestrians to cross roads a section at a time, or if looking at a direction at a time. If we go to the next slide, we did find that looking at all the various road users, the risks were actually more on the pedestrians than on the vehicle occupants. Now, some recommendations were made on how to improve some of the risks associated with the high-risk locations of the road. And most of the risks were actually to do with either speed or pedestrian safety. So what TMA, which is the Traffic Management Agency, I believe, I can't quite remember the name, and the Addis Ababa City Roads Authority went out and took some of the recommendations that we made, and they started to implement some of these along the roads that we had assessed. So we know that TMA, for example, did some speed reduction, and ACRA, they did some speed limit reassessments. They tried to reanalyze the speed limits that were set. And it was that all arterial roads became 50 kilometers per hour, collector roads became 40 kilometers per hour, and so on. And where we had the footpaths, or the streets which didn't have footpaths, those were reduced down to 15 kilometers per hour in some areas, in some sections. The other thing that was done was the improvement of road facilities. So they erected road signs, both for speed, but also for direction and for helping drivers or vehicles navigate the network effectively, but also be aware of various hazards. There were street lights installed, as well as some pedestrian guardrails, which were present and had maybe been damaged. They were reinstalled and re-erected. And these are the things that we've basically seen in the last time we checked with TMA, and this was about a year ago. So I assume that some work has been progressing. So a lot more may have been done since then. Next slide, please, Ali. So the improvements on the pedestrian safety were actually quite substantial. There was a lot of work on the footpaths themselves. A lot of footpaths actually were repaired, widened, and some allowance for sharing the space with bicycles was provided. There was a minimum 50 kilometers were planned for 2019. So I'm assuming that progress has been made and some of those have been completed. There were bollards which were installed to prevent vehicles from parking on the footpath, and that way blocking access for pedestrians and forcing them into the high risk area, which is the road. And of course, the pedestrian fences were also installed. Next slide, please, Ali. So when we looked at the data of the work that was done, and looking at the footpaths themselves, if you look at the map on the right, I'm not sure how big it is on your respective screens, but those are basically where all the footpath work was being undertaken. And this is, there were different types of footpaths that were done, different types of guard railings, some traffic calming was installed, and so on. So there was a lot of pedestrian type work that was being done in the last few years. So there's been a measurable effect on the star ratings, actually, and this has been across the entire network. Whereas we had 3% of the road was rating 3 stars or better, we now had an increase of 12%. So almost half of the road network is rating 3 stars or better for pedestrians. And even with these modest improvements, and there's a lot of implementation still going on, and we can anticipate or we estimate that there'll be 300 more deaths and serious injuries if this work continues. Go to the next slide, please. So the next country is Ghana. In Ghana, we did an assessment of 260 kilometers at different stages. This was between 2016 and 2019. Next slide, please, Ali. So in Ghana, the map that you can see shows the locations of the roads that were done and the reports that were produced from that. We find that with this project, 158 people were trained, and these were mostly from the road development agencies, so Department of Urban Roads and the Ghana Highways Authority, but as well as the consultants, contractors, and academia. So we tried to engage as many of the road stakeholders as we could. And again, we did get some people becoming accredited. So we do have some accredited suppliers in Ghana. And you can go down to the next one. So again, in Ghana, looking at the same 3 major attributes, we find that the roads which didn't have any, there were footpaths. On about half of the roads on these footpaths were existent. On the other half, some of them were either informal or non-existent. So we had roads which actually didn't have a footpath for pedestrians. 78% of the road, so over 3/4 of the road, actually had no formal footpaths. When we looked at the operating speed, so these are the speeds that vehicles actually travel at, not the speed limit that's set, we found that over half of the road had speeds over 70 kilometers per hour. The speeds did range quite a lot from road to road, hence the many different speed variants. But so it depended on, some of the roads actually had low speeds, reasonable speeds, whereas some of them had quite high speeds. We had some sections of the road where in the city, again, where people are driving between 100 and 115 kilometers per hour, which is quite serious. When we looked at the environment itself, we did find that a lot of the roads had a physical median, at least the roads that we assessed, and a few had like a simple center line, but a lot of the roads actually had a physical island in the middle, which prevented vehicles from crossing into opposing lanes. And again, like most of the story that we have in Africa, is that the highest risk is actually on pedestrians. Within this particular assessment, 22% of pedestrians were actually walking on 3 stars or better roads. You can go to the next one. Some of the activities that we did, so I don't know if the people from Ghana have certainly heard about the La Paz junction or the La Paz intersection. It's along the N1 road in Ghana, or in Accra. So along this road, almost 3 deaths were occurring in the city, and they're all occurring on this road. And as Luke mentioned before, we've had this analysis that 10% of roads actually have almost 90 or 80% of the crashes or the serious crashes happening on them. Look, you remind me of that statistic. But the N1 is particularly notoriously dangerous, and it's a road that actually splits the city. So the La Paz Junction, which is actually shown in this image, was quickly identified as a point of high risk. And we had issues such as speeding, drink driving, and high pedestrian flows, and very little infrastructure at this intersection, which caused there to be a potential for high risk. So this was kind of a focus junction for most of the partners who were working on the Bloomberg project in this city. And so designs were prepared by our partners to see how this junction could be improved. So the designs included things like traffic signals, junction improvement itself, reducing the crossing distance so pedestrians don't have to cross 3 or 4 lanes, or they cross them but they're smaller, narrower. Defining protected turning lanes to minimize rear-end crashes, reflecting again on the speed limits, trying to see how the speed limits can be better placed, and also affecting the operating speeds. And lots of signage and road markings and stuff was installed to help all road users actually maneuver this junction safely. So a speed review was also undertaken in Accra to help support some of the issues that we've been seeing all through the impact of speed on the roads that we were assessing. You go to the next one, please, Ali. Another activity that happened in quite substantial amount in Accra was the improvement of pedestrian facilities. As we saw in the star ratings, the highest risk roads were actually the pedestrians. They were most at risk. So various facilities have been installed by the Department of Urban Roads as well as Ghana Highways Agency, including pedestrian footbridges, improving the signal timing, so allowing for some pedestrian or more pedestrian crossing time, looking at the installation of bollards to prevent vehicles actually getting up onto the footpath and affecting the footpath used by pedestrians, and so on. We can go to the next one. Just another example of some of the activities that were done. So improved delineation was quite a major project as well in Accra. And I believe this was actually funded partly by private sector, somebody in the private sector. And here they did some installation of directional signs and gantries. So the ones which go over the road, as you can see in that picture on the top left. But there was also some remarking of the lanes and reflective studs. So the studs which actually help vehicles see the edge of the road, or at least know where the islands are. And you can see images of the top and bottom for day and night to see the impact of those road studs. Next one, please, Ali. And this is just another example. So in terms of minimizing severity for loss of control type crashes, there were lots of roadside countermeasures installed, so things like barriers, also creating some better junction movements. So for example, at La Paz, there was that installation of the junction box. So it was there before, but it was remarked to show that people shouldn't be crossing into this space, that way leaving the junction clear for turning movements and minimizing congestion. So also replacing fencing and signal heads to allow for pedestrian crossing, but also just to make them more visible. In summary for Ghana, we see, specifically looking at the La Paz Junction, the impact of the improvements was quite substantial. But along the entire 260-kilometer network, if all the countermeasures which were recommended were to be installed, would actually have no one-star roads for pedestrians, which is a huge, a big thing because they're the worst affected road user group. There is a substantial increase in 5, 4, and 3 stars, which is what we want. Of course, with additional countermeasures, we could actually eliminate the 1-star sections for all the road users. If we go on to the third one, which is Tanzania. So looking at Tanzania, this project was actually carried out through 2018 and 19. And for this one, the consultant actually did an assessment of the baseline assessment, as well as the design assessment. So designs were provided by TANROADS, which is Tanzania National Roads Agency. So they provided designs of roads that they were planning to build, and these roads were actually funded by the World Bank. So we wanted to see the impact of the designs on the baseline, on the existing network, and then advise on how the designs could be further improved to ensure that safety was was enhanced as much as it could possibly be. And also there was assessment of the bus rapid transit network, which was being developed in Dar es Salaam, the city, and also a road assessment of the Mafinga Igawa, which was under construction or imminently going to be completed. Next slide, please. So again, looking at the similar key attributes for Tanzania, we find that the footpaths, the percentage of the network that had footpaths present was less than 10%, or approximately 10%. 90% of the roads that we assessed, bearing in mind that there were national roads, so there were roads which were coming from town to town, so that the highways, so to speak, didn't have any footpaths. And we appreciate that it's expected that there will be no pedestrians on highways, but the reality is that there are pedestrians, and either we provide a facility for the pedestrians that are using our highways, or we don't allow them on the highways in the first place. But having pedestrians present on the highway is actually a high risk for them because they're very vulnerable at high speeds. So we did find that along these roads, 90% of the roads actually didn't have any facility for pedestrians. The same thing we did with the other, I've done with the other two countries. We looked at operating speeds, and we found that the speeds are pretty high along these national highways, as expected, as most of them were above 90 kilometers per hour. And we also find that there was no median along most of these roads, considering they're single lane carriageways at high speeds. This was considered quite a high risk. We find that looking at the road users on these networks, 4% of the roads would rate 3 stars or better, and this would probably be closer to the cities or the towns where there would be some level of pedestrian facilities. Next one, please, Ali. So looking at the 4 roads that were actually, the World Bank is considering building almost imminently in this year or next year. And so these roads were focused on a little bit more in terms of analysis. And specifically, I'm going to focus on the Lusahunga Rusumo project or road project, because it's actually gone for procurement for a contractor to be installing the recommendations, or to be upgrading this road. So I'm going to focus on this as a case study. You can please go to the next slide, Ali. So looking at the charts in front of you, I hope they're in front of you. Yes, the baseline chart basically shows a lot of black. And we've heard from previous presenters that black means 1 star, which is the highest risk road. We find that 90% of the roads for all road users are high risk, so they're rating at 1 star. And when we looked at the design, so we basically looked at what impact the design would be on the existing road as it had been completed before installation. And we found that the design actually has an impact, has very little impact on the star rating. It's still a high risk road. It still majority of it remains as a 1 star. The only actual thing we noticed was that a lot of it was becoming a 2 star for bicyclists. And I personally attributed this to the fact that as much as the speeds were high and the people are still affected, there's a wider paved shoulder than there was before. So there's more room for bicyclists to move along. So it made it a little bit safer for them. So they became from 1 star majority to 2 star. However, we did notice that the speeds along this road were 120 kilometers per hour as per the design. And knowing how we drive, or most of us drive, we generally go a little bit above the speed limit. And so if we're going to go above the speed limit of 120 kilometers per hour, which is approximately 75 miles per hour, then we're going to be really in excessive speeds along those single lane carriageways. So the first thing we did was to think about how the star rating would be improved by reducing the speed to something more reasonable, considering the kind of road that it was. So at 125 kilometers per hour, we're kind of looking at a road like the motorway standard road in the UK, or the freeways in the US. So they've got our particular roads here in Tanzania at the same speeds as the ones that we're trying to match for mobility purposes. Our road is a single carriageway. There were majorly no physical medians. There were NMTs, vulnerable road users, non-motorized users. There were sharp curves, narrow bridges, inadequate signage, at-grade junctions, and all of this on roads on that road, which is signposted at 120 kilometers per hour. So by reducing this to 80 kilometers per hour, we then achieve the star ratings that you see on the chart on the right. So for all road users, we actually eliminate all the 1 stars except for pedestrians. And the majority of the road moves from being a 1-star to a 3-star road. So in order to affect the pedestrian, because now we still have this challenge of pedestrians still rating at 1 star, we we try to see how we can further improve the design so that we eliminate these 1-star sections for pedestrians. So we then looked at the various countermeasures that we should install in this design to help reduce the risk for that for the pedestrians using that route. So I'm just going to pick on the top 3 that were considered. So not that were considered, but the top 3 that had the highest impact on safety. So looking at street lighting was one of them. So the street lighting would be recommended at where there's junctions or where there's towns or where there's anything that, the driver needs to be very much aware of, something coming up ahead. So bringing more visibility to the environment that the road users were using. So these were recommended at 13 sites, and it was predicted that these would prevent 199 fatal and serious injuries. The other thing we looked at was intersections hatching. So providing a wider separation between oncoming vehicles was another consideration that was proposed for inclusion into the design. So finding ways to separate the oncoming vehicles from each other, that way minimizing the potential for head-on collisions happening or occurring. Another one was the traffic calming and gateways, so village gateways. Most of these roads actually do go through towns and village urban centers of some kind, but there was nothing to alert the driver that there was a change of environment. So the suggestion was to provide some traffic calming within these villages and these towns, as well as provide information about speeds, what the appropriate speeds, as well as the fact that they were entering an urban center. So consideration of these locations and other features were there to, within the recommendations, were there to further lower the risk, that way improving the star rating. If we go to the next slide. So the chart on the left, hope you can see the slides. The chart on the left is the same as the one before, where we had just a reduction in speed at 80 kilometers per hour. That way, in that situation or scenario, we would eliminate 1 and 2 star travel for everybody except the pedestrians. However, installing some of these recommendations, in addition to the reduction in speed, we find that we have 5, 4, and 3 star roads, and we actually eliminate 1 and 2 star and 3 star roads for pedestrians. So the recommendation here would be, please do the speed reduction definitely as a minimum, but find a way of actually enforcing it, because we can do it in terms of signage, but we have to literally find ways of, encouraging drivers to actually drive at those lower speeds. Next slide, please. So overall, looking at the 4,000 kilometers of assessed network, we see that there's a substantial reduction in risk, with majority 1 star roads becoming majority 3, 4, and 5 star roads. So some of the countermeasures here are actually there to reduce risk for all road users and to that way improving the star ratings. And looking at the last, so if you go to the next slides, Ali, looking at the last case study, which is Senegal. This one was an assessment of the road after it had just been built. So it was a post-construction assessment of 392 kilometers, and it was 2 roads that were assessed: N2, which was north of Senegal, and the N6, which was south of Senegal. If we go to the next slide. So when we were doing the assessment of this, remember it's just post-construction, it had just been built. We found that 96% of the road that had just been done had no form of footpaths, and 95% of the network where vehicles were moving at over 70 kilometers per hour. 90% of the network had speeds of over 70 kilometers per hour at this stage already. And again, like I said before, hitting a pedestrian 70 kilometers per hour is high risk for the pedestrian. We did find again that the highest risk was on the pedestrians, and there were no physical medians at all recommended along these two sections of road. If I can just alert you to look at the chart on the bottom right, this is one of the outputs of VIDA, which I think you've gone through in the past, one of the past 3 sessions. It basically helps engineers identify what the risk actually is. So if we look at the third block, the highest risk is on pedestrians, as we can see, but we've got those purple sections. The purple section actually refers to risk associated with crossing the road, crossing the assessed road. So if we as engineers were to find countermeasures to minimize the risk for pedestrians crossing, we would actually reduce the risk rating there, would actually reduce the hazards or the risk to pedestrians. So charts like this, which can be taken out of VIDA directly, can actually help us focus our countermeasures on specific interventions, which can actually have a real impact rather than guessing at what should be the best thing for us to do. Next one, please, Ali. So for Senegal, I'm going to use this as my base scenario. So looking at this, a road section, I think this picture is taken along the N2. So looking at this for vehicle occupants, it would normally rate as a 5-star if the speeds on this road was 70 kilometers per hour. It would rate 4 stars if the operating speeds increased to 90 or 100 kilometers per hour. If the speeds increased further to 110, we'd get a 3-star road. If they went beyond that, of course, the risks get worse and worse as the speeds increase. But in order to keep this road as a 5-star road, even at 110 kilometers per hour, we'd have to think of countermeasures or safety measures to implement or to install to still minimize the severity of the risk. So if somebody was to have a crash, how can we protect them from being injured, either die or fatally or serious injuries? So installing a median barrier, if this was to be installed along this section, these kinds of road, it would reduce head-on risk, which was the highest risk factor for this particular road section. And it would actually take it back to a 5-star road for vehicle occupants at that speed of 110. So installing the median barrier would reduce the risk from 3 stars to 5 stars just from installing that median. We can go to the next one. So looking at the same scenario, but looking at the reduced speed. So we saw earlier that if we were to reduce the speed to 90 kilometers per hour, or if the speed wasn't 70 but 90 kilometers per hour, it would become a 4-star road as is currently designed. If there were roadside hazards within 10 meters away from the edge of the road, it would actually, the risks would go higher and it would become a 3-star road. The risks would go even more higher. There'd be much more risky roads down to a 2-star if those hazards, for example, electric poles or culverts, if they were within 1 to 5 meters of the edge of the carriageway. However, having that road network as it is and having the hazards within, say, 1 to 5 kilometers per hour, if we were to install safety barriers, so instead of moving the hazard, if we were to protect road users from hitting that hazard, we'd actually bring the star rating back from a 2-star to a 3-star. So protecting road users from hitting the hazard would actually increase or reduce the risk and increase the safety. Also increasing what I'm going to call the clear zone. So it's the space between the edge of the carriageway and the first hazard. So having that as a 5 meters or more would also bring the star rating back up to 3 stars. Similarly, if just reducing the speed from 90 kilometers per hour to 80 kilometers per hour, adding rumble strips on the edge as well as the center would also bring it up to a 3-star. So having the hazards in place, we can protect the road users by providing interventions to prevent them from actually accessing or hitting those hazards to increase safety. We can go to the next one, please, Ali. So again, another example of looking at the same scenario for vehicle occupants driving at 90 kilometers per hour. We saw that the design at 90 kilometers per hour was 4 stars. However, it would become a 1-star very, very quickly if there was intersections at grade. So a 3-legged intersection at grade would result in high risks. So it would quickly become a high-risk road for vehicle occupants. However, it could be brought back up to a 3-star, so reducing the risk by changing the quality of those intersections. So having those intersections well marked, so vehicles can see them coming, can see that they're present, providing better visibility for vehicles coming out of those intersections, having protected turn lanes for people wishing to go into those side roads, and providing channelization for vehicles at those junctions so they can go into the right side of the road in the first place. All those would increase the safety from a 1-star road to a 3-star road. So providing information to drivers so they can behave appropriately and know how to use the infrastructure is a very good indicator, a very good way of reducing risk. We can go to the next one. This is my last example of this scenario. And I'm going to look at pedestrians just for a change. So looking at the same scenario, the road would be a 3-star road if the speeds were 40 kilometers per hour and there were no pedestrians crossing. So it would remain as a 3-star for pedestrians, but at speeds of 40 kilometers per hour. As we've been seeing all the way through, with increased speeds, the higher the risk, and pedestrians are particularly vulnerable because they don't have the shell protecting them. The road would quickly deteriorate to a 2-star with an increase of 20 kilometers per hour. So if the speed changed from 40 to 60 kilometers per hour, we'd have 2-star roads for pedestrians. And if it went up to 70 kilometers per hour, it would become a 1-star road. So in order to have this 1-star road become a 3-star road again, for that to be achieved, we'd have to provide footpaths for pedestrians. We talk about informal footpaths, and these would have an impact. But the challenge is in our environment and in our countries is if I see a beautiful, smooth paved surface and there's a patch of worn away grass next to it, I'm more likely going to walk on the paved part. I'm going to go on the shoulder and walk, which would then minimize the point of having the footpath in the first place, or the informal footpath. So the recommendation would be maybe install the proper footpaths, install real paved or weather surfaced footpaths. And this would actually bring the star rating for pedestrians up back to a 3-star, or actually a 5-star in this case if it was a proper footpath, with pedestrians having actual facilities directly for them and immediately for them. The star rating would go up to a 5-star. Okay, so looking at next slide, please, Ali. Looking at the N2, just as a point of focus, the road as it was built had over 50% of the road was rating 5 stars for all road users except for the vehicles. So it was rating 1 and 2 stars, sorry, for all road users except vehicles. If the recommendations that were presented at the time are installed, then all of the road for motorized transportation, at least for the motorcycles and the cars, would rate 3 stars, 4 stars, or 5 stars. You'd still have some small portions of 2 stars for pedestrians and bicyclists for the non-motorized transportation. And next slide, please, Ali. So there's a lot to kind of gauge from all these projects, and this presentation could have gone on for a whole day because there's so many examples of good and bad. But we do know that design standards generally seem to work on the premise that the traffic speeds and the speed limits are the same thing. But in reality, most people actually drive over the speed limit. So unless there's good enforcement of the traffic speed limits, or there's good traffic calming facilities in the urban areas, then the traffic speeds are often above the posted speed limits. So in that reality, the designers actually need to think about the specifications. For example, they could consider using roadside specifications for speeds of 90 kilometers per hour in their design, even when the posted speed limit is 80. So we know that people drive at higher speeds. So considering that, or taking that into consideration, actually put facilities in place for the higher speed that's likely to be the reality, used in reality. So there are 3 key overarching points for this whole presentation. The first one is operating speeds are definitely key and they're central to risk. So reducing those operating speeds is an increase in a reduction in risk, so an increase in safety. Also, the RAP model actually looks at numerous attributes along a road section. So for every 100 meters, as you may have been told before, there are over 50 or over 70 countermeasures that are looked at and attributes that are looked at. Therefore, there are many ways and many options of lifting the road star rating, so increasing safety, looking at each one of those attributes and seeing how they can be made safer. In most instances, the quick wins come from protecting the most vulnerable. So looking at the pedestrian and bicycle road users is actually usually quite straightforward, and quite the benefit to cost ratio of installing those is actually quite high. So the dollars that we're spending on countermeasures such as, for pedestrians or for vulnerable road users actually are better spent, is what we've found from the various assessments. But we all know that without implementation, nothing changes. It's just a study, it's just a document on a shelf, and people keep dying. So we have to keep, as much as we're finding out all this information and learning new ways of improving our networks, we have to actually implement for there to be a real impact. And based on that and all of my talking, I'd like you to thank you for your attention, and would love to hear if you have any questions. I'm happy to try and answer them. Thank you.
Thank you very much, Rachel. Congratulations for this project that you presented. Lots of people here interested in having access to these reports and the details. Do we have this available for them?
I'm not sure about the reports, but the data is certainly available on VIDA. I think Greg went through how to access some of these reports in earlier presentations. So all the results are available in VIDA. The only challenge with some of them is the client may not have given permission for them to be visible, but those that are completed, final, and visible are, can be accessed by any user of VIDA at any level. You don't have to be a creator, for example. You can just be a reader and you can access the data.
Yeah, and we had lots of questions here about the process, how to do the star rating, how to do the coding, and the types of countermeasures. So I would just recommend here that if you haven't watched the previous sessions, you have please do go on Schoology. All the videos are available there. Watch the videos, you'll have an idea about the process. And then another question here is about data. If you don't have a very or low quality data, how much can this compromise the quality of the project or the star rating?
Well, really, all the data you need is physically on the ground. It's the infrastructure. So the items that we record, as you'll see from the other presentations or previous presentations, are you recording what's actually built. So you're recording, how many lanes there are, how wide are the lanes, what's next to the road. Is it a tree? Is it a lamp column? Is there nothing? You're literally looking and seeing and recording what you see every 100 meters. The only extra data you need is what we call the supporting data. So it's things like the crash data helps for the model to be calibrated. So it actually becomes more and more accurate. The more data you put into the model, the more accurate your results. And again, like I'm sure other presenters have said before, this is a model. It's not the human brain. It's a model created by a lot of science. So a lot of the outcomes or a lot of recommendations are actually very realistic. But if you put in rubbish, if you put, we've heard of rubbish in, rubbish out, if you make up information and put it in, you'll get a result that's reflective of the data you've put in. In essence, you just need literally the infrastructure information that's physically on the road, so it's accessible. The speeds are obviously very, very key because speed has a very huge impact on risk. So doing a traffic count, or not traffic count, a speed measurement along the road that you're assessing is also doable. It's not that hard. And also, if you can get crash data, fantastic. If you can't, the model will still give you a star rating based on the various bits of information you've put in and the analysis. So you'll still get pretty close to reality just to get the star rating of your network. It's not, you don't need a lot of analysis beyond what information you already have in your survey.
Thank you very much. for your presentation, Rachel. We have more questions for you here, but we are, again, a little bit late, and we can post the answers on Schoology. Thank you so much, and congratulations.
Thank you. Thank you, guys.
So I will ask you a little bit more of your time. We have one more presentation and our announcement in the end. So I will present for you the training and accreditation program. We had already lots of questions about this on our chat. So IRAP offers over 20 online courses that you can take at your own pace. Some of them are free. We have also we provide these courses in a few different languages, English, Spanish, Portuguese. We have one course that is even in Vietnamese, Russian, and French. So we have, for example, some are free for you to take it, to just register and you have access to it. And we have the Star Rating Essentials and the Star Rating for Designs that are the courses for you if you want to take the accreditation, the IRAP accreditation, and we have some advanced courses as well. And Julio also talked about the Star Rating for schools, that we have a course specific for that. So you can see, you can go on our website and check this list and price and languages. They are all listed there. We already had a few questions about it and the prices. So if you want to become an IRAP supplier, we have two types of accreditation. Activity accreditation, it's only for individuals. And in these activities, we have road survey, road coding, road attribute coding, analysis and reporting, and Star Rating for schools, which is only by invitation. And then the system accreditation that we heard from Luke and Julio as well. You can have the accreditation for the system on survey and coding or only on coding. So the process to become an IRAP supplier is that there is a fee that you need to pay to apply for this accreditation. Then the candidate needs to take training. After the training completion, you need to take the accreditation test for each activity that you are applying for the accreditation. If successful, then you need to agree with our code of conduct. The first accreditation is interim until you have a practice an IRAP project. And for that, you need to submit an application form with the details of this project. And we assess that and give you the full accreditation. This accreditation is annual, and the renewal is based on the supplier's performance, compliance with our code of conduct, and the client feedback. And also there is a renewal fee. So why would you become an IRAP supplier? There is this formal acknowledgement that the individual, so you receive a certificate that acknowledge that the individual is capable of performing their IRAP specification activities, or the inspection system if that's the accreditation. These suppliers are listed on the IRAP website as an accredited supplier, and this listing is frequently used by organizations procuring IRAP specification services like World Bank, ADB, and even government agencies. And you can use the IRAP accredited logo to promote your services. So what we have to offer to you, if you are a professional in the road safety area, if you live in a low or lower middle income country in Africa, we have an opportunity for you. IRAP wants to select 60 people in this area to receive access to all our courses for free and to receive the accreditation. So you still need to apply, and you have, if you pass the tests, you can renew another two years for another 2 years. The criteria of these grants are the applicant needs to be currently living and will live for the next 3 years in a low or lower middle income country in Africa. The applicant needs to choose one of the 4 categories, which is male, female, over and under 29 years old. So you see in the application, it can't be a beneficiary of other IRAC projects. The applicant needs to explain the reasons to apply for the IRAC grants program and how you are going to use the acquired knowledge and the accreditation if selected. So, and another criteria is that you need to complete this course. Watch all the videos or the series and complete the assignments, the materials that you have there. So you see here, the applications will open on Monday. So it's not open yet. You probably receive an email with this information again. This is the link. The applications will go until 20th of August. And we'll announce the selected applicants in September. I just want to show you a video. I hope it works well. It doesn't have a sound. So we have, as I said, we have a few questions now. I will try to answer some of your questions if we can, but I am happy to help you with more information by email. You see my email around these slides, and also we've been in contact. My Alessandra Francoia email or the training at IRAP.org are my emails. So good luck. I hope to see some of you in the applications next week. So heading to the end of our webinar session and webinar series, I want to conclude in saying that what we saw today, a summary of our presentations. We saw Julio presenting a guide with the different steps that can be taken to develop a locally owned and led RAP in your own country. We also saw that where crash data is not available, this was even one of the questions, infrastructure safety data can be attained and cost-effective interventions can be easily identified and installed to help make our roads safer. Without implementation, Rachel emphasized that nothing changes. People keep dying on the roads we are building. There are many attributes used in the IRAC model. Therefore, there are many ways and options for lifting a road's star rating. And I've concluded presenting the IRAC training and accreditation program and the grants opportunity for Africa. So your assignment part 4 is we have a discussion forum on your course, and we would like to hear from you. How you can use IRAC methodology to save lives in your country. Tell us of how, from everything you saw on these 4 sessions during 2 weeks, what can you use and explain which parts of the model you could use and the benefits and how you could advocate for this implementation. What is your takeaway and call to action on this? And if you haven't accessed the course on Schoology yet, go to their website and access with this code. Please create a student account. You don't need to complete the school. It's a student account and use this access code. The course will be open until 30th of July. We won't be able to extend, so please rush there. You still have 2 weeks to complete the activities, and we'll issue the certificates after the completion. But this will be in the second week of August. And again, please, your feedback is very important for us. When we finish the session, there will be an evaluation form. We value your contribution, and we try to include during the webinar series your inputs as much as we can. Please give us your feedback. And now, heading to the end, I just want to call Arif Uddin to give his final words. He's the transport specialist, Global Road Safety Facility at the World Bank. He also support the organization of this webinar series. He was part of the coordination. Arif, please, the mic is yours.
Thanks, Ali. Congratulations to you and IRAC team for arranging this fantastic, engaging webinar series. I'm very excited to know about the grant opportunity for Africa, and this is much needed opportunity for our colleagues in Africa. I'm sure they will take this opportunity to be an IRAC accredited professional and improve safety in their respective countries and the Africa region in general. Also, thanks to Bloomberg Philanthropies for partnering with us and funding our activities in 15 countries. I'm sure many of you are in touch with our BigRS partners. I'm grateful to my GRSF colleagues, Alina, Tawia, and of course, Rachel for their active participation and contribution. Last but not least, congratulations to our participants from all around the world. You're the heart of our program, of our webinar series, and I hope you will find this webinar series highly useful. Thank you so much for all of your active engagement for the last 2 weeks. I appreciate your trust to know more about road safety and work together to improve road mishaps by evidence-based comprehensive approach. In the next couple of years, we will have more capacity building activities across the world. So keep your eyes on our website, visit our latest resources, and let us know if you have any queries and comments. Let's work together to make our roads safe and make the world a better place to live. Thanks everyone again. Bye.
Thank you, Arif. Thank you so much for your words. So finally, big thanks to our presenters today for sharing your experience and knowledge with all of us. Congratulations for all the work you have been doing to improve safety on our roads. I would like to give the opportunity for them to say the final words. Julio?
Alessandra, thank you very much for the opportunity to present how to build a local program in your country. Thank you for all the people that paid attention to our presentations during these seminars, and really great news about the grants that are going to be available for our African folks in all the countries. So I hope that they are going to apply to these grants and get knowledge in IRAC. Thank you again.
Thank you. Luke?
Yes, thank you, Ali. I just want to say thank you to GRSF and Bloomberg Philanthropies and the World Bank for their support, and also particularly to all the participants that have been on the 4 different webinars that we've had over the last few weeks. And I wish them all good luck in their future road safety projects. Thank you.
Thank you. Rachel, your last minute.
Yeah, thanks Ali for organizing this and the team that really put this together. But as like Luke said and everybody said, to all the funders, the supporters, the participants, it's been really long. It's a 2 whole weeks, 4 sessions. It's a lot to do. So all I can maybe add is we're here to support your work. We would love to, get involved. We actually enjoy getting involved, so don't be shy to ask. Speed Management Hub under the GRSF is very, very useful tool. The IRAC methodology and the various protocols in there are very useful. We are very definitely, certainly, and happy to support you in all the things that you're doing. So do get in touch. And thank you so much.
Thank you, Rachel. And thanks everyone for attending our last session of the World Bank and IRAP Helping Save Lives in Africa, BIGRS 2020-25 webinar series. Thanks for your participation, your questions, contributions. It was a pleasure to be with you during this series and see your motivation and enthusiasm to use IRAP methodology to save lives in your countries. Thanks to World Bank, BIGRS, or Bloomberg Philanthropies Initiative for Global Road Safety. Thanks to Global Road Safety Facility for your commitment to road safety and for supporting this webinar series. And we look forward to your applications to the star rating, the IRAP training and accreditation grants. And we'll keep in touch on Schoology. Bye.
Bye, Ellie. Bye, everyone.
Bye.